Hello, everybody, and welcome. We will be getting started shortly.
Hi, and welcome to our monthly webinar. We are indeed pleased to have you join us. I will take a minute to introduce who we are and what we're doing in the next couple of months, and then introduce our speaker. And my colleague from the California Labor Law, Laura Trupin, will be handling the Q&A at the end of the session. So the California Labor Laboratory is a NIOSH Total Worker Health Center of Excellence. We are focused on emergent working conditions. We're a collaboration of UCSF, UC Berkeley, the State Department of Public Health, with participation from faculty members from elsewhere. Our mission is to extend the pursuit of health and safety for traditional employment to those in a wide range of alternative working arrangements in partnership with communities of interest to the labor market. I want to point out that next month, we, by the way, meet on the fourth Wednesday of each month. Next month, Professors Ellen Reese and Julianne Allison from UC Riverside will be presenting their work on the warehouse industry in the Inland Empire of California. And we all know how important that is. That industry grew more important during the pandemic and continues to be an essential aspect of the California economy. We also want to point out that beginning on May 17th and running for 2 days, we're holding our first annual conference by virtual means because many people tell us the pandemic will not be completely over. And the speakers on the first day you see before you, the keynote is by Professor Jacob Hacker from Yale University. The other people you see there. And the second day, John Howard, who's the director of NIOSH, will be given keynote, and the other speakers that day include the people listed on the slide. We want to make sure that you are aware of how to get in contact with us, to see what we're doing, and how to register for our webinars and conference, which can be done on our website. I am going to stop sharing now and also now introduce our speaker, Mr. Patrick Carey. We had a good conversation for a few minutes before the webinar began. I noted with interest that he graduated from the University of Michigan, and he informs me that he has very strong ties there, not just because of the sports programs, but we all know that the University of Michigan is one of the foremost places in the country to train people who are interested in the public sector and improving data collection in the public sector through their Institute for Social Research and other august departments in that campus. Mr. Carey currently serves as an assistant commissioner at the Bureau of Labor Statistics, and he has a very broad portfolio. He oversees the current population survey, which many of us consider a lifeblood, the American Time Use Survey, local area unemployment statistics, and national longitudinal surveys. So I will turn it over to him just with one remark that it's amazing that anybody could do that job. It's just a very broad range of very important data sources for our country. Mr. Carey?
Thank you, Ed. I should just note that I have a lot of help for carrying out these activities. I'm going to share my screen here. Okay, can everyone see it?
It looks perfect.
Okay. All right, so I'm glad to participate in this webinar for the California Labor Lab to talk about developments in the BLS household and payroll surveys. Certainly there's been a lot going on over the last couple of years. It has had dramatic effects on the labor force, continues to the present time. What I plan to do today is first go over some results from the BLS payroll and household surveys, really to kind of give a sense of where we are. I'll briefly talk some of the issues that we had with estimation during this time, and then I plan to cover some of the results for California from the payroll and household surveys. And then finally, I'll have a brief just discussion on the our plans for the contingent worker survey. Okay. So just we're going to focus on the payroll side here first. Here we're showing the non-farm payroll employment over the last 10 years. As of February 2022, jobs have recovered about 90% of the 22 million jobs lost in March and April of 2020 due to the pandemic. So we're just shy of about 2.1 million jobs from February 2020. Here we're looking at some industry detail compared with February 2020, which was the month prior to the declaring a pandemic and the resulting shutdowns. You'll hear me refer to the pre-pandemic period, and that's really what I'm talking about, is that February 2020 data point. You can see here that professional and business services and transportation warehousing are currently the two industry super sectors that have expanded the most after recovering. Other industries that have recovered include retail trade, financial activities, and information. You can see here that leisure and hospitality still have a lot of ground to cover here, with most of that needing most of the job shortfall in food and drinking places. Government job shortfall compared to February 2020 is mostly concentrated in local government. And within the education and health services super sector here, healthcare accounts for most of the deficit. So I've selected a few industries to highlight in the next few slides. Manufacturing employment is still 178,000 below its February 2020 level. Last month, we saw widespread increases in manufacturing industries, partly offset by job losses in motor vehicle and parts. I know that's been a lot of discussion about supply chain issues and chip shortages affecting car manufacturing. So I think that's really an industry that we want to keep our eye on. Retail trade is an industry that I think is interesting. Retail trade is fully recovered and is now above its February 2020 level. I don't think this is one I would have predicted, to be honest. In the year or two before the pandemic, we were showing a decline in the number of jobs. So this will be interesting to see how this industry plays out in the coming months and year. I mentioned earlier, employment in transportation and warehousing has surpassed its February 2020 level. This was led by strong growth in warehousing and storage, couriers and messengers. Also notable, air transportation, which was an industry that was hit particularly hard during the pandemic, has surpassed its pre-pandemic employment levels. Employment in professional and business services has expanded above its February 2020 level. This is largely due to growth in temporary help services, computer systems design and related services, and management and technical consulting services. And here you can see, this is an industry that's always of interest, temporary help services. You can see now employment is above its February 2020 level. But it's a fairly noisy series in terms of the payroll side. Here we're showing employment in healthcare. It was interesting to think that we've had a devastating health event, and yet employment is below the pre-pandemic period, at least to me. I think early on there were many articles about people putting off non-emergency procedures, doctor visits. However, ambulatory healthcare is above its February 2020 levels. Where we're seeing most of the job shortfall compared with February 2020 is in the nursing and residential care facilities. And I have a graph here. Nursing and residential care facilities have shed, even in the last year, shed over 100,000 jobs. And since the February 2020, it's been about 400,000 jobs. But we see at the last few months that employment in this industry has stopped declining. So maybe we've hit a bottom with employment losses in this industry. Although I have heard anecdotally too that many, now you have to understand this is nursing and residential care facilities, so this is an industry, not an occupation. But I heard that a lot of nurses have stopped working and or stopped their hospital or nursing care facility jobs and are now working in temporary, doing like temporary help jobs or but nursing, still nursing, but they're getting paid more doing not working for a hospital or nursing care facility. Certainly earnings and inflation are big concerns in the news recently. We are charting both here in this chart. This chart shows over the year percent changes in average hourly earnings among private sector employers. That's the red line, compared with over the year percent change in the CPI, the blue line. You can see here that the CPI has been running higher than earnings for many recent months. Also worth noting, the spike in April 2020, which was, I think we're all familiar, was largely due to the compositional effects. Much of the initial job loss that occurred among industries with lower wages, such as leisure and hospitality. Just switching quickly to the household side, the unemployment rate is down considerably from its high of 14.7% in April of 2020, but it remains slightly higher than the February 2020 level, which was 3.5%. So we're only about 3 percentage points from equaling our low. This chart is kind of interesting. It's a chart that shows employed people who are not at work due to their own illness, injury, or a medical problem or appointment. The shaded areas here represent peak flu season, which is really December through March, as determined by the CDC. Historically, people are more likely to be absent from work during peak flu season. You can kind of see that in the historical data. The blue line here shows the number of employed people who usually work full-time but were at work part-time due to illness. The red line shows the number of people who were not at work the entire survey reference week due to illness. Both measures reached all-time highs in January 2022, which was when the Omicron variant was pretty rampant. But they've come down in February back to levels we've seen before. In this chart, we're showing job loser status and unemployment reentrants. The number of unemployed people on temporary layoff is down from its high of 18 million in April 2020. It's still slightly above its February 2020 level. The number of unemployed people not on temporary layoff is higher than its pre-pandemic level. And in February 22, I wanted to mention that of the, Blacks and men were overrepresented among those not on temporary layoff relative to their share of the labor force. Whites and women were underrepresented, and Asians and Hispanics or Latinos were about proportionally represented to their labor force. BLS added questions to the household survey in May of 2020. You may be aware of that, to help gauge the effects of the coronavirus pandemic on the labor market. All questions refer to activities at any time during the last 4 weeks. We have seen a considerable drop since May 2020 in the number of people who telework because of the coronavirus pandemic. Note that this doesn't reflect all telework, but specifically telework related to the pandemic. That's the question that we have there in the CPS. I think it's interesting to see the January bump when the Omicron variant resulted in increased infections. This is another one of our COVID questions where we are asking people who are not in the labor force whether they are prevented from looking for work due to the pandemic. This series also shows a drop since May of 2020, though we still estimate over 1 million people are in this category that say they were not in the labor force and did not work because of the coronavirus pandemic. Labor force participation rate has certainly been discussed since the pandemic started. We are still 1.1 percentage points below the level seen prior to the pandemic. For a while there, it was stuck in a narrow range of, I think it was 61.4 and 61.7% from June 2020 to October of 2021. But you can see here, there has been some movement up in recent months. Note that the movement from there was some a jump in from December to January, and I wanted to just mention to you that that was really affected by the implementation of the 2020 decennial population data. We do that once a decade, of course. There were some compositional effects where we saw increases in the age groups that are more likely to participate in the labor force and decreases in populations less likely to participate. So just be aware of the December 2021 and January 2022 changes. There are some compositional effects. In terms of unemployment rates by sex, very early on in the pandemic, we saw higher unemployment rates for women, which I believe is largely due to industries affected early in the pandemic. But you can see here that the trend in rates for adult men and women are similar after the initial shock. You see some little bit of differences now, certainly with the employment population ratios, where I don't think I think women, I don't have a slide here, but the like men have almost recovered. I think they're about 0.6 of a percentage point away from their February 2020 level, whereas women are over a full percentage point. I can't remember what it was. Okay, so in this very busy chart, we're showing unemployment rates by race and Hispanic ethnicity. Rates for Hispanics have returned to their February 2020 rate of 4.4%. The monthly American Indian and Alaska Native series shown here is a recent addition to our time series database. Certainly it's a bit noisy owing to the small population size, but we think there's some, you can definitely see some longer term trends here. And it really is interesting to see how much that April 2020 rate spiked. It was almost, I think it was around 28%, a little higher than 28% during the April 2020. This slide shows unemployment rates by educational attainment for people ages 25 and up. Interesting data point here is that the February 22 unemployment rate for those less than a high school, with less than a high school diploma, dropped 2 percentage points over the month to the lowest level since the series began in 1992. So we'll see if that holds for people with less than a high school degree. But I'll note that the labor force participation rate for that group increased, which is promising. I know with the louse estimates, I'll get to those in a little bit. We did see we had some states where we saw some very large drops in the unemployment rate that were accompanied by drops in the labor force participation, which to us meant that people were just stopped looking for work when and this occurred when the shutdowns were happening, were more prevalent from state to state. This chart shows that those who are working part-time for economic reasons, meaning they prefer to work full-time, but the number of people working part-time for economic reason is below its February 2020 level. And our latest numbers show that there were about 99 million individuals not in the labor force, meaning they were neither employed nor unemployed. Of course, many of those are retired individuals or people that don't want to work. We, of course, as you're aware, that among those in the labor force, the survey identifies people who want a job, and the number of people not in the labor force who want a job is slightly above its February 2020 level, but well below its April 2020 level, which was the peak during the pandemic. And this chart simply shows the alternative measures of labor underutilization, the U1 through U6, you're probably familiar with. All are slightly above the pre-pandemic level, but all are trending in the same direction here. Okay, so some of the challenges that we had during the pandemic, probably of no surprise, we certainly had some data collection issues, especially early in the pandemic. We had data centers closed, people were working remotely and making phone calls. That was occurring in CES and CPS. We also had our in-person interviews, which are very crucial to supporting our relatively high response rates. Our in-person interviews were suspended, call centers were closed, and respondents were contacted by telephone. And telephone interviews, if you know our survey, of course, we have a person, a respondent, or a household, I should say, is in the survey for 4 months and then out for 8 months and then back in for 4 months. So that first month and 5th month in the sample is the in-person interviews are very important to get engagement for people to participate in the survey. CPS response rates, which had already been trending down for the last decade, hit a low of 65% in June of 2020. Again, not having in-person interviews certainly did not help. As in-person interviewing resumed, some in the ensuing months, the response rates improved. We were certainly above that June 2020 low and are right around 73% for the last few months, but that's still low compared to what we were seeing before the pandemic. There were adjustments on the CES side to the birth-death model from April 2020 to September 2021. Relationships changed between business births and deaths. In October 2021, BLS reverted back to a methodology used prior to the onset of the pandemic. So we're sort of somewhat back to normal in that respect. You also may be aware of the CPS misclassification issue we had, and that we talked about in a lot of our materials when we released the data. This had to do with counting some people who were not at work during the entire reference week for reasons related to the coronavirus as employed, but not at work. There's lots of reasons people may not be at work. Vacations are one, illness is another. In this case, we had instructed people or interviewers to code people that said they weren't at work because of the coronavirus as unemployed on temporary layoff, and that was not occurring in certain interviews. We did produce an upper bound estimate of the misclassification through January 2022, but you should note that upper bound estimate, there are a lot of assumptions that go into that figure. So again, we think that's an upper bound estimate. We think the real incident of mass misclassification is somewhat lower than what we were presenting. And seasonal adjustment was a challenge. CPS had to change many of its series from multiplicative to additive factors in order to avoid data disruptions. CPS made adjustments to seasonal adjustment models to better account for outliers, which you can imagine were very numerous given the number of series that CPS has. Recently in CES, you're probably aware that revisions in January for some months in 2021 were pretty large, but really they were mostly offsetting during the year if you kind of tallied them up for the year. And that's, we had a better sense of what was going on in the economy when you have future observations. So that was very helpful to inform our seasonal adjustment procedures. And if you really want a deep dive here on seasonal adjustment, I've included the annual CES article link. And I've also included it's not posted yet, the 2022 article isn't posted yet. That would reflect on 2021 for CPS, but that link will take you to where that will be published, and it should be out soon. All right, moving on to data from California. We start with non-farm payroll data from the current employment statistics survey. And note that the data I have here reflects through January. February data will be released on Friday. From February to April 2020, California lost nearly 2.8 million non-farm payroll jobs for a decline of about 15.6%. The US shed about 22 million jobs over these same 2 months, which was a contraction of 14.4%. The relative percent recovery for California is lagging that of the nation, as you can see on this chart. Same two industries in California as in the US were still down by the largest numbers of jobs as of January 2022, leisure and hospitality and government. Similarly, the two industries that were up in California also had, that's transportation and utilities and professional business services, also had the largest net job gains nationwide. It's another look at this, the net percent growth from February 2020 through January 2022 in California. We're showing here that it's lagged that of the US for all industry supersectors except transportation and utilities, where the net advance in the state has outpaced the net advance nationally, and education and health services, where the net contraction has been smaller than in the state than for the US as a whole. Compared to the US as a whole, we're kind of showing a distribution of payroll employment by industry here. There were relatively more jobs in California in the professional and business services sector, also in information. Information includes motion pictures, and relatively fewer jobs in financial activities. So this chart kind of gives you kind of maps out the industry distributions. Okay, so turning to Laos data, I just wanted to say a few words about some of the challenges that the Laos program encountered. The onset of COVID-19 created enormous challenges. While the U.S. data come directly from the current population survey, statewide Laos data are model-based, using CPS state employment and unemployment estimates as primary inputs, along with non-farm payroll employment estimates from the CES program and counts of unemployment insurance claimants. We talked a little bit about the challenges of the CPS data earlier, response rates and misclassifications. I'll note that California's CPS response rate averaged 80%, roughly 80% in 2021. That's down from California's 2019 average, but it is above the national average, so that's good. For the state-based estimates, there were additional challenges. Early policy responses to the pandemic resulted in a relaxation of the requirement for active job search as a condition for receipt of regular unemployment insurance benefits. Also, there was, of course, the creation of new temporary unemployment insurance benefit programs. And so what Laos was sort of faced with in its models were the relationship between UI recipiency and the activity-based concept of unemployment underpinning the CPS was disrupted, which really greatly reduced the efficacy of using the claims counts to try to mitigate volatility in the CPS tabulations for states. Also, the pandemic gave rise to historically unprecedented movements in the model inputs. It became necessary to engage in real-time outlier detection so that the models would not inappropriately discount real movements in the data. The operational difficulties that this posed prompted the Laos program to develop and implement a new generation of time series models in early 2021. These models greatly eased the operational difficulties of real-time outlier detection in 2021. However, real-time outlier detection still carries with it a risk of mistaking extremely unrepresentative sample for a real event. So we really had a struggle. We almost had more of a struggle with the recovery than we did with the initial, well, we did have more of a struggle. It was pretty clear what was happening early on, but as the recovery happened, it was a lot more difficult to model. So all caveats aside, our data indicate that California's unemployment rate rose from 4.1% in February 2020 to a new series high of 16.1% in May of 2020. Since then, it has steadily declined, and in January 2022, the rate is at 5.8%. California's EPOP ratio has consistently tracked below that of the US, registering at 58% in January 2022. California's ratio remained 2.2 percentage points below its February 2020 reading. The national ratio of 59.7% as of 2022 was 1.5 percentage points below its reading. So, the California recovery is still lagging even the U.S. recovery. This is a chart that shows data from the job openings and labor turnover survey program. So JOLTS, they produce a monthly data on job openings, hires, and separations. And here we're blending the JOLTS estimates of job openings with estimates of unemployed from the local area unemployment statistics for California. And for the national data, the CPS data, to track the ratios of unemployed people to job openings in California and the US during the pandemic recession. Ratios for neither area exceeded the highs seen just after the end of the Great Recession. However, California matched its series low of 0.9 unemployed per job opening in November and December of 2021, while the US ratio has been below 1 since July of 2021 and has been sitting at its series low since last November. Okay, using annual average data, this is data directly from the CPS, and it's not Laos data anymore, but when we also put out annual average data from the CPS to publish data by demographics. Here we're using annual average data for California. A few observations. Men and women have rates that differ little from those from the total population. Teenagers have rates substantially higher than those of the total population. Whites have lower unemployment rates than blacks, and people of Hispanic or Latino ethnicity and Asians have below average unemployment rates. These pie charts show the distributions of the civilian labor force ages 25 and older by educational attainment in California and the US as of 2021. According to the CPS, California has the highest share of workers with less than a high school diploma among states. That's at 10.5%. The only other state with more than 10% of its workforce in the less than high school diploma category was Texas at 10.1%. Here, the broad trends in unemployment by educational attainment have been similar for California and the US over the last few years. Those with a bachelor's degree and higher had the lowest rates as of 2019 and experienced the smallest rate increases in 2020. While those with less than a high school diploma had the highest rates as of 2019 and experienced the largest increases in 2020. From 2020 to 2021, those with less than a high school diploma had the largest rate declines. Recent trends in unemployment by veteran status are similar for California and the US. They mirror those that have been discussed for major demographic groups and educational attainment categories. That is, large increases from 2019 to 2020 that have been partly offset by decreases from 2020 to 2021. And note that the 2021 veteran unemployment rate in California was nearly as high as the pandemic recession peak for veterans nationwide in 2020. Just note here on the veterans data that the age universe is for veterans and non-veterans that are 18 years and over. Here we're showing the broadest measure of labor underutilization, the U6 rate. Wanted to just mention that California's 2021 U6 rate of 12.8% was significantly higher than the corresponding US rate of 9.4%. Among states, the only Nevada had a higher U6 rate for the year, which was 14%. For both California and the US, the long-term unemployment shares in 2021 approached but did not match their respective peaks associated with the Great Recession. So you can see here that large increase from 2020 to 2021, which was expected in long-term unemployed. Okay, so I just want to move on to talk a little bit about the contingent worker supplement. So the May 2017 contingent worker supplement collected information on two different types of employment, contingent jobs, alternative employment arrangement. Contingent workers are people who do not expect their jobs to last or reported that their jobs are temporary. Alternative employment arrangements include people employed as independent contractors, on-call workers, temporary health agency workers, and workers provided by contract firms. These data were collected in a special supplement to the CPS, the monthly household survey that, of course, provides the employment and unemployment data for the U.S. Information about contingent workers and alternative work arrangements was collected in the CPS in 5 previous surveys, each time in February. So the last time we conducted this supplement was in 2017, and then the time before that was 2005. So there's a big gap there. It's kind of worth noting that employed individuals were asked questions about their main job. That is the job that they usually work the most hours, and that was one of the I'll get to this in a second. One of the recommendations from the CNSTAT group was to ask about second jobs. So always good to remind ourselves the origins of the supplement. Interesting to think about the concerns that were voiced in the 1980s and where we are now 40 years later. Still many of the same concerns here. As I mentioned, the Committee on National Statistics, CNSTAT, of the National Academies of Sciences, delivered a report in BLS to BLS in the fall of 2020 on measuring alternative work arrangements using the CWS. The report reaffirmed the importance of measuring alternative work arrangements and had 14 recommendations. And BLS is reviewing these. Some recommendations will be easier to accept or implement than others. For example, they point out how some low priority topics, so some contingent detail, work history, transition to work arrangement, could be eliminated and make room for new items like asking questions about secondary jobs. So we're developing topics and questions for revised contingent worker survey to be fielded in July of 2023. Everybody likes more data, but we always have to remind people that we are limited. This slide lists some of the concern change questions. I'll note of these items, the 2 items that are kind of important to keep in mind, that the 10-minute threshold, it must not exceed 10 minutes per household, and also the requirement that proxy respondents must be able to answer these questions. I did want to mention a couple things, and I'm sure you're aware already, but other BLS data sources that may have CWS-like information are the National Longitudinal Surveys and the American Time Use Survey. NLS collects some data on intermittent work, variability of hours, schedules, advanced notification of schedules. Time use has information on work from home, which is obviously a big subject now, and control of schedule or advanced notification of scheduling in their leave and jobs flexibility module. And I did want to mention, well, I mentioned already that CPS has done some work on pandemic-related telework, and I presented those results. Those are part of our COVID questions, but so has the NLS program. So I think the NLS, I don't know if they've come out with information or not yet on their COVID questions, but information should be trickling out soon on the BLS site. Also, that what may be of interest to this group is the new business response survey. There was a questionnaire first questionnaire was covered the July-September 2020 period. And we just published, I believe in February, results from the, in February 2022, results from the July through September 2021 reference period. So, and I provided a link there for if you wanted to take a look at that. Okay, I'm finished. Yes, should I stop sharing my screen?
Yeah, it's up to you. You can also leave it for the contact information if you
Okay,
want.
sure.
And again, if anyone has any questions, go ahead and enter those into that live Q&A box, and we can start asking them now.
Hi, everyone. I think you should all see me now. I'm Laura Trupin. I am the Center Coordinator for the California Labor Lab. First of all, thank you very much for your really informative talk. It was both interesting and challenging to absorb all that information. I'm very glad this is being recorded so we can go back and review some of it. I am going to throw out a couple of questions and continue to send additional questions as you have them to the audience. First of all, it seems that well, clearly the pandemic affected all sorts of everything. And in terms of the way that it affected the data collection that you did and the methodology and the analyses that you did, particularly things like how you collect the data, moving away perhaps from some of the in-person, as well as some of the new methodology that you mentioned about outlier detection, et cetera. I'm wondering if any of those are now going to be implemented onwards as the pandemic reaches its next phase or conclusion.
Yeah, I mean, we are, I mean, you know, for when I think about the CPS, for example, I think about, you know, that in-person contact has been really key to our you know, relatively high response rates for a household survey. So losing that, I'm not sure what we can do. But I will say that one of the things that we are, you know, one of the things we're trying to look at is some other ways to collect data, other modes to collect data. One is we are kind of investigating a web-based instrument, which will be challenging for CPS because you know, because of the timeliness of CPS, right? So you have the reference week, and then immediately the following week we're collecting data for, you know, for about 6 or 7 days, or well, for about 7 or 8 days, I should say, and then, you know, we need to get rolling on tabulating and putting together our estimates. So yeah, I mean, there are things that we're taking a look at. I think there are sort of things about, you know, we had to, you know, the Census Bureau is responsible for collecting the data for the CPS. We work in partnership with them. And I know that they had to rearrange some, you know, what might seem minor, but becomes major in an event like this, like trying to get accurate telephone numbers and such.
Okay, thanks. And this is a little bit of a fanciful kind of question, but you mentioned at the end when you're looking at the list of, you know, constraints on the supplements, it made me think of what you might think of if one or more of those constraints went away, or if a pile of money came your way that you weren't anticipating. What would you target as the first couple of things that you would like to see added in to, for example, a contingent worker survey?
Yeah, so I mean, certainly there's a lot in this area that could be collected. You know, and we're kind of forced to make choices here. I would say that I mean, we're certainly looking at collecting data on second jobs. I think that's very important for contingent workers and alternative work arrangements. It would be also interesting to look, you know, we're covering the reference week. It'd also be interesting to maybe look a little further back to try to, and this is what the NLS program kind of does, looks at, asks questions about intermittent work. I'm not sure that we're going to be able to collect the, you know, intermittent work in the CWS. But, you know, a lot of these constraints here are not, I mean, they're certainly money is an issue for sure, in terms of what we can do. But we also have to be cognizant of not adversely affecting the CPS, and not, I mean, we're already having issues with response rates for the basic CPS. So those are some big concerns.
Absolutely. So have you done any work with estimating biases due to the CPS response rates declining, both before the pandemic as well as?
We're working on some information. I believe that, I want to say that there's I can send it to one of you. I believe there's a paper out there done by one of our statistical methods people that looked at biases during the pandemic. But there's some ongoing work going on as well. I think Census Bureau is working on some bias work as well too.
That's great. I believe that we are, if there are more questions, please go ahead and put them in the chat. I mean, sorry, in the Q&A. I think right now we're probably ready to wrap up. Thank you so much again for your talk.
Okay, great.
Yeah, if you can stop your share, I think maybe Jess wanted to talk a little bit about some upcoming events that are happening. And again, thank you so much for joining with us and for your very informative talk.
Yes, thank you so much for joining us. Thank you to Laura also and Ed for being here today. I did just want to quickly discuss that we have a special upcoming event. It's a 3-part OEHS equity webinar series that will be done in partnership with Michael Flynn, an anthropologist and lead social scientist for NIOSH, where he coordinates the Occupational Health Equity Program. If you're interested in any of our upcoming webinars or events, just go to coeh.berkeley.edu/webinars. This first webinar is going to be identifying, understanding, and addressing occupational health inequities through research. And that's going to be Wednesday, April 6th at 12 o'clock. And again, don't forget to join us for the next California Labor Lab webinar on April 27th, 2022, where we will present Amazon, Warehousing, and Health in Inland Southern California, Intersectional Feminist Perspectives and Praxis. All right, thank you again. I hope everybody has a great and wonderful day. Thanks, Laura.
Thanks for joining us.
All right.
Bye.